I get a lot of questions on if we offer pellets or not. And the answer is no. I don't like pellets for a few reasons. They can work for a small population, but it's kind of more of a place and pray, meaning that it is a procedure where you make an incision and butt, flank, kind of back area, and then you use a trocar and you make an incision and push these pellets into the subcutaneous tissue where they're slowly absorbed over 3 to 6 months. And if they work and you get it right, they can be okay. But there's a lot of extra variables in there that I just don't like, so we don't offer them. One is that they are not adjustable. Most of the time they're placed in, we get too high of levels and you're not tolerating it well. And there's not much to do aside from maybe try more medications and just wait it out. If it's too low, you have to make another incision and place more pellets. And each time you do that is more scar tissue, chance for infection. You can get what's called seromas, where you get just fluid collections and they're not really doing much. The pellets can work themselves out. You can have nerve damage if it's placed up against a nerve or you go through a nerve on the insertion. These are all really rare, but again, just reasons why we don't offer them. The last thing is starting hormone therapy in younger and younger patients. If you're in your 30s and 40s and we're having to put these pellets in, over 10, 20, 30 years, you're going to get a lot of scar tissue that can be cosmetically unpleasing. It can affect absorption. So I just don't like them. From a business standpoint, they would be pretty awesome. I just make an incision, throw some pellets in you and say, come back in 4 to 6 months once you need more. But that kind of takes away the management and adjustability of it. Injections, creams are just so easy. If we need to do something, we can change it, and it takes a week to feel the effects. Injections sound intimidating, but they honestly get pretty easy. You can use us to come in and we can work with you on getting used to it, how to do it, bring your spouse in. If they're doing it, we can teach them. It's intimidating at first, but it gets so easy. It's just part of your day. You can draw it up, inject yourself while you're having a conversation and not even hardly think about it. Creams are a great option. They're not injections. We can do that. Some of the hormones, estradiol, progesterone, have great oral options. There are just more options that are controllable and just have less risk overall. The pellet insertion is pretty low risk, but why not go to minimal to no risk with injections and other options?